Around the World with MS World. I'm Dr. Daniel Kantor, and I'm so happy to be joined by a great friend of MS World, by Dr. Doug Jeffery, who is the director of the MS Clinic at Piedmont Healthcare in Lake Norman Neurology. Dr. Jeffery, I want to thank you so much for joining us. You know, for a long time we've had these conversations about what really causes MS. Is there a virus involved? Is it not? Is Epstein Barr mono or the kissing virus, is that involved? What did we hear at the meeting this week that really plays into that?
Well, there's a lot of actually interesting data that's come out in the literature in the last few years, and Dr. Hunter was just talking about meta-analysis. So one of the interesting meta-analysis that was done a few years ago showed that if you hadn't been exposed to Epstein Barr virus, that your hazard ratio for having MS was 0. That means that having Epstein Barr virus exposure is a prerequisite to getting MS. So most people get exposed to Epstein Barr virus when they're little kids and they get exposed through their mother's saliva, hence the term the kissing virus. Most patients don't get mono. That occurs with a later age infection when they get infectious mononucleosis. So there's a tremendous amount of epidemiologic evidence suggesting that Epstein-Barr virus is intimately related to the etiology of MS, but we haven't been able to explain how. So more recently, people have started to look at Epstein-Barr virus microRNAs and other Epstein-Barr virus-associated proteins, which might actually mediate disease activity in multiple sclerosis, because the Epstein-Barr virus lives in these cells that are called lymphocytes, specifically B lymphocytes, and it's immortalized within them. So Epstein-Barr virus is known to contribute to a number of other diseases, including lymphoproliferative disorders in immunocompromised patients, nasopharyngeal carcinoma, and Burkitt's lymphoma. So one of the really interesting studies that was presented at this meeting was a preliminary study where they've developed a cytotoxic T lymphocyte that is directed against Epstein-Barr virus infected cells. And when they gave that to patients with progressive MS, they saw significant improvements. Now, it was a small preliminary study, but this is very, very interesting and very exciting because of what we know about Epstein-Barr virus and how it acts. So many of us think that Epstein-Barr virus is intimately related to the development of multiple sclerosis. And this is really a very exciting new development. It's very preliminary, but this could lead to major advances in MS treatment.
You've been involved in a lot of research and a lot of clinical trials. To give people back home an idea of, let's say that it looks like this data is really true. What's going to be the next step? What are we looking at? What kind of time horizon till people back home can actually see treatment like this?
Okay, that would probably be more than 5 years out from now. And it takes a long time to develop these treatments. And for example, one of the things you have to do is you have to determine how effectively these cytotoxic T lymphocytes are actually eliminating Epstein-Barr virus infected cells, because you need that as a marker to see how effective your agent is actually removing these cells. And then you have to go through the standard clinical trial process, which is phase 2 and phase 3. They've done phase 1 studies, and they've done phase 1 studies in other types of Epstein-Barr virus mediated diseases. So I would guess it would be about 5 to 6 years before anything like this could really be realistically available.
Well, Dr. Jeffery, thank you so much for joining us yet again, and we hope to follow up with you in future conferences to see where we're going with this. I know it's a question a lot of people have at home, whether a virus could be the cause of their MS, whether treating that virus or preventing that virus could be useful to them. Thank you so much for joining us, and thank you for joining us at home.